My name is Dr. Miracle Amaefule, and I'm an optometrist by profession. And by the grace of God, I am the CEO of TAAE Foundation, and it's my privilege to be serving this great foundation under the great leadership of our founders, in the person of Mr. Manakalo Onuma and Miss Brenda Astudillo. And as the name implies, you can already see the where the names come from, and hence they came together and partnered to form this great foundation and founded this great foundation. And yeah, we may be young, but God has been helping us so far so good to touch a lot of lives. And it's in the bid to continue to do what we do that we decided to gather everyone here. The vision and the mission of this foundation and the key part of this foundation is to reach out to people who are living with all manner of disability, to help people who are disabled and empower them. So today is my singular privilege to present, to be the first presenter. It's very for us to delve into the issue of disability care, empowerment for persons with disability. We also have to have a background information and understanding about, the laws governing disability care, the Disability Act of Nigeria, which was enacted properly, or rather kind of upgraded in 2019. Against people with disability prohibition act, discrimination against persons with disability prohibition act 2019, and then the law prohibits discrimination based on disability and mandates accessibility in public buildings for people living with disability, transportation and services, and it stipulates a 5-year transitional period for modifying public structures to be accessible. And however, we have a challenge, as it's always in Nigeria. A lot of people do not know about the Disability Acts and the laws surrounding the disability rights for people living with disability here in Nigeria. And as such, we are still battling with a lot of confusion, and we are battling with a lot of misconceptions surrounding all manner of disability, whether it's childhood disability or whether it's an acquired kind of disability. People who are living differently are oftentimes marginalized, right? And so today's topic is ability in difference. And we'll be looking into championing inclusion, rights, and empowerment for persons with disability. And first, I want to say today that there's nobody who is disabled. I don't know if you can hear me. There is nobody that God created that you can say that doesn't have any form of ability. So right now, we're on a campaign to rephrase the word disability to, differently abled persons. So every human being that God created has a unique feature and something that, they can do, right? That's something that is peculiar to them, that only them can be able to do the way they can do it. So there is no singular person on earth who you can say is disabled. So the importance of inclusion cannot be overemphasized, right? We're here to talk about inclusion. Inclusion ensures equal opportunities in education, employment, and societal participation. And why is it important and beneficial for people, living differently to be included in every aspect of the society? Is an inclusive society benefits from diverse perspectives and talents. Promoting inclusion reduces stigmas and fosters empathy and understanding. And I will add to say that, inclusion is also a very important part of economic development. If Nigeria recognizes people who live differently and decide to care for them according to their needs, it will not only foster, the sense of inclusion, but it will also create a niche of economical growth for us in Nigeria. What do I mean? You can see the whole Japa syndrome right now going on in Nigeria. A lot of people are traveling to do what exactly? to go and care for people who are, who are needy in other countries. The care industry in UK, United Kingdom, the care industry in Australia, the care industry in New Zealand is totally a boom industry, that even people are being sponsored from other countries to come and fill in the gaps for these people, to show you how much they care about both their aging population and their disabled quote unquote population. So it's very important that we, as a country, Nigeria, we start to embrace the right attitude and the right mindset towards people who are living differently from us, right? And so we're going to be delving into stories or life examples of people who are making strides, who are, kind of making impacts, who, even though they may have one physical form of challenge or the other, they have already changed the narrative. People like Jessica Kos, she was born without an arm, but she's the world's first licensed armless pilot and a black belt in Taekwondo. Imagine someone who doesn't have hands, who doesn't have limbs, battling people in Taekwondo. Oh my goodness. When I read this, I was blown away, right? So this is determination. This is what an inclusive environment, an inclusive society can do for people who live differently. Imagine if this woman was probably in Nigeria, or in one village where people are instigating and laughing at her and making her feel bad, and tossing her somewhere, just telling her not to come out, not to show her face and all that, just because she was born different. But look at her. She's something else in the US. She's a United States citizen. She flies planes using just her feet, and she has inspired millions of people. And she's also a motivational speaker and a disability. Mike Shoggs, oh my God, this man is phenomenal. You can see the limbs. If you can highlight the pictures, you can see his legs. He is an amputee, but he didn't let what happened to him to weigh him down. Even as an amputee, what did he do? He went ahead to think about other people like himself. He said, even though there's a limitation, but I'm not going to let this thing define me. I'm going to use this as a means to inspire other people. So he went ahead to design prosthetics for athletes, enhancing mobility and performance. Today, he's recognized in the world of Paralympics. He is the one who designs most of the running gadget for the Paralympians in the world, and he's phenomenal. Inclusivity and diversity, right? That's exactly what we're talking about. People who live differently from us, who don't look exactly like our picture of normal. And who is to say that we are even normal, but people who we think are not normal, So it's very important for us as people to start promoting a culture of inclusivity. And what do we get in return? It fosters diversity and enhances employee morale, especially in the place of work, right? Where we'll be talking of legal compliance, adhering to accessibility standards, ensures compliance with disability rights laws. So if you have an office, you're an employer, if you dare reject somebody who, because the person came in with one limb, but this person's brain, you have not looked into the brain, just because of physical appearance, you say you're not going to employ the person. It's better people start knowing that there are laws protecting people who are different from us. And those laws can actually get whoever is an employer that is discriminating, seems to be discriminating, right? It's already in the Nigerian law 2019. Coming back home, we have somebody back here in Nigeria, and you can see how beautiful she looks. You can see how amazing. This lady you're seeing here, she developed cancer at the age of 20 on her leg. And as a result, she had to undergo an amputation. But it did not stop her. She went ahead to study law. She became a lawyer. She's a known media personality in Nigeria, and she's an advocate. And she didn't just stop there. Presently, she has an appointment with the Lagos State government as an SSA for people living with disabilities in Lagos State. She didn't let her situation hinder her. And we also know people like mothers like Jody the singer. Our Jody, we could see how she gave birth to a child with cerebral palsy, and even her husband abandoned her, or her partner at that time, But Jody sacrificed. She's our hero. She sacrificed her career just to take care of her child, who is a special needs child. And she didn't just let it there. She decided to be a beacon of hope. She decided to inspire people. Her name is Joy. It's Hungarian, aka Jody. You know Jody now. Kuchi Kuchi, yeah. The woman that did I Understand. You know this popular Kuchi Kuchi song. She is the singer. And she founded the Chinua Children Care Foundation to support children with special needs after her personal experience, one of which is her son, who is battling with cerebral palsy, like I said, you know. And also, the first lady, you can go back to the last slide, the other lady, she also founded Iride, this Adenike, founded Iride Foundation, you know, that caters to people who are amputees. She helps them, sponsor them for sports. And, you know, she's also a swimmer. She has a award in swimming. So these are people who have refused to let limitations or physical limitations keep them down. They have risen above physical limitations, and these people inspire us all. How do we, for people who have loved ones, because that's what this seminar really is all about, is about educating us and educating the public on how to cope with people who are living with disability, quote and unquote, or who live differently or who look differently from us, right? So what are the coping mechanisms for special needs people or people who have one disability or the other? So you have personal development, and that's what we do here at State Foundation. That's what we aim to achieve. We want to encourage people to support, you know, people who are living with disability, encourage participation, just the way you're all gathered here today. You're doing something, whatever information you hear today, you can go. I believe, God, that it will, you know, inspire something in you to go out there to start seeing people who live different, who look differently from you in a better light, right? And give them the emotional support that they desire. We're trying to, when the foundation reached out to some students in the University of Abuja, and we wanted to take a toll of people who are living with disability and know how they're coping with their education, how they're learning. And some of the stories we heard from them wasn't exactly, you know, nice. Like in comparison to our foreign counterparts who live abroad, we're hearing things like, okay, discrimination. They don't even have a desk, a special needs desk in a whole learning institution. And it's not just that, it's almost the same thing in almost all the universities here in Nigeria. And for change to start, the change has to start with, you know, the future, the next generation, the younger generation. And that's why we're also trying as the foundation to target these kind of places, the educational system. The education needs to start from the right source. We need to start, you know, put it in people's head, kind of recalibrating our mindsets to understand that there's need for a sense of inclusion, to embrace people who look differently from us. Okay, so they told us things like, oh, sometimes some lecturers actually fail them when they don't come because they did not attend school, even the ones on wheelchair. Some of them, their lecture halls are upstairs, and there are no, you know, wheelchair disability stairs. How do they put it now? There's a word I'm looking for now. Can someone help me? Like walkways, ramp, thank you. So they don't have those ramps where the wheelchairs can go through. So before some of their friends can agree to even carry them up, they must have missed a test, or they must have gone halfway into missing the test. So these people struggle every day just because they are Nigerians. And it ought not to be so, you know. So it's important that we promote skill acquisition and continuous learning, which is what we're doing through this webinar. It's good that we foster self-advocacy and confidence-building activities. It's good that also we encourage the production of, you know, technological aids. Start looking into it. You can see that most times, if nobody can do it, if nobody can think for you, you have to do it yourself. These are people that turned their story into something productive, because nobody is going to come to their rescue. They saw that no other person would do it better than they themselves. So they decided to take it upon themselves to think ahead, right? And be a solution rather than be a problem and a pity party and all that. But for you to be able to even come to that place, you would have an enabling environment where your mental health is, impacted upon positively. And unfortunately, for most people in Nigeria who are living with disability, they don't have that. They don't have that support, mental support. Why? Because our society, we are filled with a lot of negative tendency to stigmatize people who look differently from us. So the technological aids is something that people, Nigerians, Africans should look into to help people who are living look differently and make it affordable for everybody, right? Then we have assistive technologies and devices like hearing aids and all whatnot. Some of those aids are very expensive. People who are poor can afford it. And these are things we're advocating for, for governments to come in, people, NGOs, big NGOs, small NGOs, partner together to make sure that people who are living with disability have access to these things, where they're not even asking for too much. So what is the call to action? What is the solution then? What are we expected to do? How can we help people living with disability? How can we ensure that this inclusion is perfected, that they are not stigmatized? How can we do that? Number one is for policymakers to strengthen the implementation of the disability rights law. There's something about enacting a law, and there's another thing about implementing that law. So in Nigeria, unfortunately, we find it difficult to implement things. We are always good to say things in theory, but implementation is a problem. Allocate budgetary resource disability inclusive programs, not when we have disability institutions in Nigeria. I don't want to badmouth anybody, but imagine a country where they quote millions and these millions don't reach people. The other day we were at Karomajiji. The foundation went to Karomajiji. I don't know if anybody's in Abuja, if you know the place called Karomajiji. It was a gory sight. We wept, but we didn't want to weep there because we wanted to, give them that sense of dignity. But immediately we got into our cars, we started crying because these people were living in Bacha, in stinking gutter. Their feces, their human waste come outside. They don't have toilets. Then they managed, some people that said their organization came and put some water things there, and they didn't even bother to check whether the water is working. Of all the water projects they put there in the midst of their human physics, only one is working. Meanwhile, there are like 4 of them. So that's the problem of implementation. When you do something, do we follow through? Do we have checks that ensure that people who are living with disability are properly supported, that they have the needed support that they deserve as human beings? I mean, that's freedom to life, basic things that human beings need. Just toilet, good water, clean water. Nobody follows through to see, and yet they will quote that these things have been done, and the monies that have been allocated will be said that it has been done. Whether it's been done, nobody knows. We know the story. We can only imagine. Communities, we are to create inclusive spaces and opportunities for persons with disabilities. It's not enough, speaking these things in urban areas like Abuja, Lagos. We need to take the message to rural areas. Imagine rural areas where it starts from as much as when you're in the village. I don't know whoever grew up in the village or visited village, at least lived in the village for a couple of times. I don't know me. There were points in my life where I lived in a village. So I know how those village children can be very brutal. And these are things they learn from their parents. So imagine that a child that is different from them. They can give him one nickname. Maybe, let's say, Tochukwu Otuaka. In Igbo, it means one hand Tochukwu. That would be the person's name for life. Imagine that kind of stigma. How would that kind of person, how would that kind of individual thrive? How would that person's self-esteem be built to the point where they can actually think of something creative in their head? So the problem is a lot, and it's our responsibility as people to start sensitizing people, individuals in rural communities about, creating a safe space for individuals who are living with disability, right? We need to challenge and change discriminatory attitudes and practices for individuals. Exactly what I said. maybe people who are living in urban areas may not experience the bullying, even in primary schools, secondary. It starts from, from nursery school. Tell the children in schools, don't discriminate, don't laugh at this person. The fact that this person has a big ear or doesn't hear very well or walks a certain way does not give you the right to look down on the person. We can even enact the fear of saying, if you laugh at someone who lives different from you, you could actually go to jail. Yes, it could be something that, put fear in the other children not to do that, and teach them how to respect other persons. Educates oneself and others about disability rights and inclusion. Support organizations and initiatives that empower persons with disability. But the key takeaways are embracing diversity, inabilities enrich our society. So we have to go beyond looking at people's physical appearance and embrace, look beyond, even for people who have mental incapacitation. Miss Nifemi will tell us, I'm sure her children, the ones that have one mental incapacitation or the other, there's something that is unique about those children that the other child doesn't have. I'm sure, even though, because we visited her home, there will be always something distinctive that one particular child, even though he or she has a challenge that is different and peculiar to that child, that other children do not possess, that is his or her own identity. And if we give them an enabling environment, it will thrive. Just imagine the boy Kenechuku. Just the other day, he entered World Guinness Book of Records. That's Kanye, right? Kanye, that boy that drew a canvas on the national stadium. That boy is autistic and he doesn't talk. I think he's nonverbal. So it's only, imagine the patience, imagine the love, the amount of care that was poured into that child to make, that child harness and bring out his giftings. And the whole world, even people through abroad, CNN covered the story of our own Kanye. It was a beautiful thing. When I saw the video, I was literally crying. I was in tears. Just imagine that Kanye was in a village, in a rural community. Let me not go far. Just imagine that Kanye was in a toxic home where illiteracy, when I mean illiteracy, because there are some people who are graduates, but they are illiterate in some things that has to do with caregiving. So just imagine that little boy did not have the kind of love, the enabling environment, and the safe space for him to, harness his giftings and his crafts. That one would have just been another sad story, But thank God for his mom, and who understood his needs, who sought help, who asked the right questions and got the right answers, and decided to, take it upon herself to care. Please, let's clap for mothers in the house. Mothers are amazing. Mothers are exceptional, honestly speaking. Not that fathers are not, but there's a special grace God gives to most mothers, that it's beyond comprehension. Imagine a child that doesn't speak, a child that will not be able to express how they feel, when they feel. All they do maybe start crying or throwing tantrums or breaking things. How do you cope with that kind of child if you don't have if you're not equipped with the right information, if you're not equipped with the right teaching? So in conclusion, persons with disabilities, we build more inclusive and equitable. By recognizing and supporting the talents and rights of persons with disabilities, we can build a more inclusive and equitable world. So we have to recognize, we have to be supportive, we have to be, I don't want to use the word accepting, not tolerating. There's a difference between tolerating someone and accepting someone. We have to be accepting of differences. We don't have to tolerate people's differences. We have to accept who they are with respect. Understand that we are not the creator. We don't give life. And who is the creator that created them, God Almighty, has a purpose for that life. And since every life is precious, we have to treat every person with the dignity that they deserve. So that said, I think I will be wrapping it here and hoping that whatever questions will come, anyone I cannot answer, I will throw to don't worry, I think I will try. Thank you very much and for having me, and I hope you guys had something to take away. Thank you.
So very much, esteemed Dr. Miracle. Now it's clearer now why you are a doctor. Okay, it's very clear because all these insights are quite deep and far-reaching. You can't even begin to imagine. People really need to begin to rethink how they've been acting towards people with disability, how much help they've been giving to people with disability. Some people don't even know that there's a way they shouldn't talk to people with disability. There's a way they shouldn't treat people who are different. And that's the essence of this webinar. And thank you so very much for such, like I said, far-reaching contributions and showing us examples of people who, in their situations of being different, have still gone ahead to excel in their different chosen careers, both here in Nigeria and outside. So thank you once again, esteemed Dr. Miracle. Now, before I invite our next panelist, esteemed Mrs. Astudillo, who herself is deep into what we're talking about. I mean, our foundation has visited one of the places where she takes care of children and people with disabilities. And you need to see the number of persons there. And this woman has a number of members of staff who help her to take care of them. And to think that one person is shouldering all that is very challenging. Well, like I said, before I bring her on, I just want to say, as you would expect, this session, this webinar is being recorded, and we are going to publish it so that everyone who has missed what we are doing here would participate, albeit later, okay? Then the other thing I'll say is, if you have questions, any question at all, whether regarding what has been said, what will be said, or outside of this, but you know it pertains to people with living differently, you could still note it down at the end of esteemed Mrs. Astudillo's session. We are going to take your questions. You just drop your questions in the comment section, the chat section, okay? So that we can come back to them and pick them one after the other. Thank you so very much. Now let's go to esteemed Mrs. Astudillo. Please, ma'am, you will tell us a little about yourself, what you're doing for people living differently, and then go into what you have for us today. Thank you very much.
All right, good evening, everyone.
Good evening.
My name is Mrs. Astudillo. I'm a psychologist and a certified autism specialist. I have a home for children with special needs and also a school for children with special needs. So the home caters for children with disabilities who don't have anyone to cater for them. So the home is not for well-to-do parents that decide to dump their children there. You know, we have children who are orphaned, some were abandoned even by their parents. So we have children that were brought to our home by the FCC administration. You know, when children are dumped by the roadside, sometimes they bring, and they have disabilities, sometimes they bring them to us. And then we have children who have been subjected to abuse, rape from low-income families, those who their father, probably the mother has abandoned to the father abandoned to the mother. And so those are the kind of children we cater for at the home. And the home doesn't just accommodate them, we also provide interventions for them. For those who had, we had a child that when she was brought, her PCV was 8%, she was almost gone, you know, but we provided medical intervention for her. Now the child is doing well. So we provide all forms of interventions, therapy, physiotherapy, medical intervention, and all sorts for them. Also for the school, children are brought in daily from their families, from their homes for therapy. So the children are assessed after the assessments. We enroll them into the center and then we teach them according to their needs. It's not like a regular school where the children are just placed in one class and then one teacher teaches them. No. Normally, we are supposed to do one-on-one therapy, but because we are in Nigeria, we can barely afford that. But then we still try to group these children according to their needs, and then we have an IEP, individualized educational plan or program that we use to work with them daily. So the children are we give them assignments. We try to encourage the parents to also work together with us. Consistency is key when it comes to therapy. So we try to work together with the parents. We give assignments. We repeat everything. We are not hiding anything. So we repeat what we do at the center at home as well. And by the grace of God, we've had testimonies. Children are doing well. One of my students wrote an exam in his regular school and immediately was given an admission letter. He's been with us for 2 years. So by the grace of God, some children need therapy for a long period of time, while some they just need the intervention for a while. And let's not forget that children learn at their own pace. As much as we do, we try to do what's right for them as well. Children learn at their own pace, so we need to give them their time. So thank you. So today I'll be talking about neurodevelopmental challenges in children. So I'll be talking about the categories of disabilities I work with. So first, I'll be talking about autism spectrum disorder. Like the last speaker said, she mentioned Kanye. Kanye is a child with autism. And then for those that don't understand what autism means, I'm sure when they see Kanye, they'll be wondering that this child looks normal in quotes because Nigerians, we always say normal, abnormal. And the truth is that nobody is normal. We don't have disabilities. We all have challenges. So nobody is normal. So for autism is a neurodevelopmental challenge that affects three aspects. It affects their speech, it affects their behavior, and it affects their socialization. For speech, some of them have few words, while some are non-verbal. While some communicate, but they find it difficult to initiate conversations, to keep up with communications and all of that. Some have issues with socialization. They just want to be on their own. While some they like to, they don't know the difference between a stranger and a family. They just meet everybody and all of that. And then it affects their behavior. Some of them are very hyperactive, some are hypoactive. So when it comes to autism, it's either it's on the high side or it's on the low side. So that's why I said some are hyperactive and some are hypoactive. Some can children with autism, you see some of them they can't stay in a place, they can't sit in a place. They are always, everywhere. They are jumping around. Some of them climb tables, climb the walls, climb the bed, try to bring things down and all of that. Fine. Children are usually hyperactive. Because sometimes when parents tell me that, oh, my child is doing this, my child, I tell them that there are some things these children do, not because they have a disability, but because they are children. So children are naturally hyperactive. They like to play around. In fact, nobody wants to have a child that just sits in a place throughout the day. So they play. But when the play is, excessive, it leads to destruction and all of that, then that's a cause for concern. So I'm going to be talking about the symptoms of autism. Autism is not a physical disability. You can't say a child with autism and say, oh, child has autism. It's not easy to identify children with autism because our definition of disability in Nigeria is when you are visually impaired, you are hearing impaired, you are walking with a stick or you're on a wheelchair, that is disability for people. But they don't understand that there are some people with neurodevelopmental disabilities that it's not physical, but you have to really take your time to study them before you understand what they're going through. So for children with autism, they start showing signs from when they are even from few months, but we don't pay attention to those signs. That is why it's always good to study milestones of our children. Milestones are age-specific goals, what a child should do per time. We should understand that when a child is 1 year, the child should start walking. When the child is so time, the child should start making sounds and all of that. So, but when parents don't know these milestones, it's difficult for them to trace when there's a challenge, when there's a problem. Fine, some children experience delay. For instance, my children don't work on time. When my children are one, they are not yet working. They start working at 1 year, 3 months, 1 year, 4 months. But when a child is not working at 2 years, that is a sustained delay, and that's a red flag. So when a child is not speaking yet at 1 year, we should not conclude that, oh, this child has autism. This child has that. No, we should give them time a bit and watch. But when a child is 2 years and the child is not saying any word, that's a red flag. As a baby, you carry a baby, you smile at the baby, you make sounds. A baby should respond back with sounds. A baby should look at you. So when a baby is not doing all of that, the baby is just looking, no emotions. Sometimes they don't even cry, sometimes they don't smile, just wondering what's going on. So those are signs they exhibit when they are still very young. And when they are getting to age 1, when you expect them to start blabbing, and in autism, some children actually start making sounds, they start talking, they start doing all sorts, and all of a sudden, at 1 year, 6 months, they regress. There is no explanation why that happens anyway, but some of them started talking, and all of a sudden, they just regress. But for the regular symptoms are they start showing signs of hyperactivity, hypoactivity. They are restricted. Sometimes they like to play and arrange things. They just do some kind of weird things, and you're wondering that what's going on. Some of them like to spin. Some of them like to hold something. They just want to have something. They are fixated on a particular object. Anywhere they see pen, if a child is fixated on pen, anywhere the child sees pen, he will make sure he grabs the pen and holds it. And before you can get the pen from them, it will take time. So they exhibit all forms of behavior, repetitive words, echolalia, for those that can speak. When you say, "How are you?" the child should respond with, "I'm fine," or "Fine." They say, "How are you?" "Are you okay? Are you okay?" So they repeat words, and then they say all sorts of, they love routine as well. Some of our children here, they know the time for outdoor session is 11 o'clock. Once it's 11 o'clock, some of them start crying, they start standing up, they expect you to take them out. So they know routine, they know when it's time to eat, they know when it's time to sleep, they know everything, which the regular child might not even be able to pay attention to. So can you see that that's the strength for them? They are very sensitive. So for children with autism, how do we diagnose that a child has autism? When a child is 2 years, and any assessment done at 2 years is not the final assessment. If a professional assesses the child, that's not the final assessment, because they are still children, they are still growing. But when a child gets to 5 years and the child is not speaking yet, that's why they always say, okay, you can repeat the assessment after 2 years of therapy, to know if the symptoms are still there. So the way to assess them is to take them to first a pediatrician. The pediatrician will do a critical assessment. They check their mouth for tongue tie. They check for other things, even their heart, their chest, their hands, their legs, their everything. And then they will tell them to go for MRI, brain scan. Most times when they go for the brain test or the brain scan, they actually don't see anything. But all those tests need to be done just to rule out anything. Hearing test. A lot of times, some parents say, "Oh, my child is not hearing because he ignores." Those are the signs of children with autism. They ignore. They hear their name and they ignore. They don't respond to their name. So sometimes, even when they do the hearing test, they can see that they're actually hearing, but they ignore because of the fact that they have autism. So when the assessment is done, then the child can be referred to a psychologist to do some other assessments. The parents will be called in for questioning and all of that, and then practical assessments will be done. We don't depend on what the parents tell us, because sometimes we've had situations where the parents tell you, "Oh, my child can do this, my child can do that, my child can do this," and at the end of the day, when you assess the child can barely do half of what the parents said the child can do. And at the same time, there are some strengths that they have that their parents might not be able to identify. So it's the job of the professional to do a proper assessment. Afterwards, the results be given to the parents and all of that. And the next thing is interventions. So before we go to interventions, let's talk about the causes. There is no cause for autism. I always say autism is a mystery. I don't know if I'm right. Because there is no cause. You can't actually prevent, but there are risk factors, genetics, environment. They tell us, "Oh, don't expose yourself to toxins in pregnancy." Because those are the things we need to follow. As a matter of fact, when a woman is pregnant, it's always good. I'm not a medical doctor, so I won't do the job of a doctor. But then it's always good to take folic acid. Let us leave all those oyibo medications, all those additions. No, let us, even the whites, they don't really take medications like we do in Nigeria. Once we see a medication outside, it was made in so country. This medication must be good. When a woman is pregnant, the regular folic acid, those local counting ones, the if you need folic acid, what we need to do is to eat well, eat right. And before you get pregnant, you start taking folic acid to prevent any form of challenge, developmental challenges in children. So once the mother is eating well, going for regular checkups, you can actually avoid some of those things. And we need to avoid staying in environments where there are toxins, insecticides, paints, and all of that. Then genetics too. Some people have the genes in their family. So that's why sometimes you see some families, they have two children with autism because it's in their gene. However, you cannot really prevent autism. Even when you are very careful, when you are careful, you do all the tests and all of that, it's possible to still have a child with autism. But it's good to be careful anyway. Go for regular checkups during pregnancy. Sometimes for children that have for children that have lack of oxygen at birth as well, they have autism. So for autism, is a lifelong disability, but it can be managed, and early intervention is key. The reason why a lot of children don't have access to early intervention is because it is autism. So people are not seeing the disability they expect to see. When a mother is saying, "Oh, my child is not speaking yet," even in Nigeria, here, medical doctors, they tell parents that, "Don't worry, it's because your child is a boy. It's because it's the firstborn. It's because it's this." And because of that, parents delay intervention. Early intervention is what works anywhere. I love parents. I have sometimes parents from their 2 year olds. I want to start therapy. I'm always very happy when I see them because at that moment their brain is still in a blank slate. So whatever you put into their brain, they absorb it. So that is the time we need to start training them. We need to start teaching them. We need to start telling them what to do, speech therapy, behavior modification, and all of that. Those children thrive, better than those that interventions are delayed for them. So the interventions they need speech therapy, behavior modification. Behavior modification is a therapy that focuses on inappropriate behavior. A child biting, eating others, rocking, doing all sorts of things that are not okay for a child. The work of a behavioral therapist is to work on that. Occupational therapy to teach them to be independent, self-help skills, everything we are doing is for independence. So we teach them to be able to take care of themselves, to brush their teeth, wear their clothes. We take them out on road work, we take them out to shops to learn how to, use money to take care of themselves. So educational intervention as well. And it's not all children with autism that need to be in a special needs. As much as I have a special needs school, I would not advocate that every child with autism should be in a special needs school. If the child has so much strength, the child is toilet trained, the child is independent, the child has few words, and the child can sit in a class, the child can actually go to regular school. However, with the help of a therapist can still work along with the therapist. But at the same time, we see situations where the child has no speech, the child can hardly sit still, the child is not toilet trained. The child practically has no, there is no, how do I put it now, no strength at that moment. Most times when parents take their children to this school, because in course they believe when they bring their children to special needs schools, oh, my child will start learning from those other ones. Discrimination happens everywhere. It happens everywhere. So those whose children have autism, they feel their children will start learning from those with cerebral palsy. Oh, my child will start drooling. My child will start doing this. So they take them to a regular school. Most of these regular schools, they don't have the capacity to take in those children. They don't have the capacity to provide the right interventions for those children. But they promise the parents that, don't worry, you are going to employ a therapist, you are going to do this. But at the end of the day, what happens? They leave these children at the back of the class. Sometimes these children are even abused in school. The child is just practically wasting his or her time in school. So at the end of the day, when the child is like 6 years, 7 years, it now end up bringing the child back to a special needs school. But if a child has so much strength, the child is toilet trained because the teacher is just one in the class. Sometimes we really can't blame these regular schools. They are not trained to work with children with special needs, and we cannot force it on them. As much as it's a rule that we don't discriminate and all of that, we can't force it on them. If they cannot take care of them, it's better they open up to us and let us know that we cannot cater for this child than leaving the child abandoned without intervention, nothing, and the child is just wasting his or her time in the school. So it's always good to provide individualized care for the child. After a while, we've had children. Recently, one of my children came from Qatar for therapy, and now the child is doing well. In fact, another parent is planning to bring their child to Nigeria for therapy. So once they are engaged in therapy for a while, they improve, and then you can integrate them back into the mainstream school. So let's move. And there's no treatments. We don't give medications. I don't recommend any form of medication. The only medication that can be recommended is omega 3 for brain development. And then sometimes they recommend magnesium. But all those, oh, take this medication, your child will start talking. It doesn't work. What works is therapy, consistent therapy. I'm talking from experience. Consistent therapy, that's what works. But in situations where a child is extremely hyperactive and destructive, we have a child like that in our home that he spoils things. Once he's awake, he's spoiling things. He tries to injure other children, a lot of that. So children like that can be placed on medication. However, this medication is not what can sustain them for a long time. Therapy is still what works. Because once this medication wears off their system, they go back to how they were, and then even worse, they start displaying and doing all sorts again. So we don't recommend medication. What really works is therapy for children with autism. Then we'll still go to management care. So I want to pick on cerebral palsy. Now, cerebral palsy is the common disability in children. It's the most common disability in children. And it's a physical disability. So when you see a child with cerebral palsy, you can easily identify that this child has cerebral palsy. Cerebral palsy is a group of disorders that affects posture and movements. And it can occur before the child is born, during childbirth, and after childbirth. Cerebral has to do with the brain, and palsy is weakness. So you can simply say that cerebral palsy is a weakness of the brain. Though in a layman's language, it's brain damage. That's what it's called, brain damage. So I said earlier that it can occur before the child is born. Instances where probably the mother had a very big fall in pregnancy that affected the baby, or if there's a low supply of blood or oxygen to the baby in the womb, it can affect the child's brain. And during the process of delivery, this is the most common cause. Let us forget what is on Google or internet. This is the most common cause of cerebral palsy in Nigeria. Prolonged labor. You know, when a woman experiences prolonged labor for a long time, you know, we have people who don't want to go through cesarean section, and oh, I want to give birth like the Hebrew women. At the end of the day, they go through labor for a very long time. By the time they give birth to the child, sometimes eventually they even do the CS. CS they were avoiding. They eventually go through the procedure. But at the end of the day, by the time the baby is born, the baby is too weak to cry. That cry is what takes oxygen to the brain. That cry is what tells the brain that this baby is out, start functioning. So once the cry is missed, it causes a brain damage for the child. And in some situations, for those that give birth in hospitals that are not well equipped, when they notice that the child needs oxygen, they administer oxygen immediately. But in those kind of hospitals, in the process of transferring the child from one hospital to another, the brain is already damaged. So it affects the child for life. So we try to talk to parents, because sometimes some parents after giving birth they go back to sue the hospitals they gave birth, because some of them tell these hospitals that can I give birth to this child through CS, and they tell the mother that keep trying. So sometimes it's not even the mother's fault. It's some nurses are not even well educated or well equipped to have all of this knowledge. They don't know what happens at the end of the day. So they tell the mother that keep trying, keep trying. At the end of the hospital should run a comprehensive test to know the level of the bilirubin level of the child, to know the level of the jaundice of the child. Because when jaundice is much and is left untreated, it affects the child's brain. it goes into the brain too. So in some situations, you see that they change the child's blood. Sometimes the child goes through phototherapy and all forms of treatments. But if the level of the bilirubin is low, they might just tell the mother to go on with the child and then just put the child by the morning sun, just let the child go out in the morning and all of that. But in some situations, this test is not, hospitals that you give birth and then you just go home immediately. And when mothers or people around, when they start saying that the child's house is becoming yellow, instead of going back to the hospital, they start telling the mother that, don't worry, it's normal to have jaundice. Just take the child outside. They don't know the level of the jaundice. So they just tell the mother, oh, take the child outside, let the child go. But when it gets worse, they end up going to the hospital. And by that time, it might have entered into the child's brain, which will cause a brain damage. Another cause for cerebral palsy, after the child has grown to like probably 1 year, and the child has meningitis. I have 2 children like that. They were already growing, they were already achieving their milestones and all of that. If meningitis is not well treated or not treated on time, it can enter into the child's brain too and cause a brain damage. And what happens? It starts like fever. And when it starts like fever, people will start telling you that, oh, it's teething. The child is just teething. It's just fever. It's just this. It's just that. By the time it gets really worse, probably the child start having seizures. So for children with cerebral palsy, physiotherapy is very important. You can start physiotherapy as early as less than 1 year. The moment it is discovered that this child has cerebral palsy, physiotherapy can be done as early as possible. Then some of them have hearing issues. Some of them you need to check their high side, their highs and all of that. So we have situations where people with cerebral palsy are actually doing well. If therapy is done early enough, we have some, even Nigerians. We have Tobiloba Ajayi. She has cerebral palsy and she's a lawyer. We have quite a number of them that are doing well. Then the last one I'll be talking about is Down syndrome. Down syndrome is a genetic disorder. The child is born with an extra chromosome. Another word for Down syndrome is trisomy 21. As a child, every child is born with 46 chromosomes, 23 from the mother, 23 from the father. But on the 21st chromosome, there's an unusual division. So there's an extra chromosome. That extra chromosome is called trisomy 21. So from what I said now, it's a situation that can not really be prevented. It's not anybody's fault that there's an unusual division. So that unusual division is what causes Down syndrome. And in the case of Down syndrome, you can easily identify children with Down syndrome, even when they are born. Immediately they are born, you can identify because they have the same physical features. For children of humans or adults, people living with Down syndrome, they look alike. Those in China, in Nigeria, in US, anywhere they look alike because they have the same physical features. Their eyes are slant, their hands and their legs are short. Sometimes they have stunted growth. Sometimes they are chubby. They have a short neck. They have a flat face. So because of those physical features, they look alike. So you can easily identify. They are the children some people call imbeciles sometimes. So, but for Down syndrome, it affects their intellectual ability and it affects their development. That's why some of them, you see a 30-year-old adult with Down syndrome looking like 12-year-old because it affects their growth. There is no cause. There are just risk factors. For in civilized countries, you can do genetic testing before you get pregnant. Be sure that you don't have the gene that can produce Down syndrome. But according to studies, when a woman gets to the age of 35, older eggs have the tendency of producing genes that can have children with Down syndrome. So that's why it's always advised that we give birth early enough. Although we've seen parents that have children with Down syndrome that are less than 35. So they are just risk factors that, as you're growing older. And then if it's in the family, because it's genetic, if it's in the family, it's possible another person has a child with Down syndrome. And also for some parents, we've seen a lot of parents who had children. Probably they had like 4 children, and then they decided that they were not going to have children again. All of a sudden, after 10 years, they get pregnant. It's possible to have a child with Down syndrome. If the gap space is too long, it's possible to have a child with Down syndrome. So there are just risk factors. You've seen people who are very young and have children with Down syndrome, but it's also it can be prevented if genetic testing is done. To be able to know if it's possible to have a child with Down syndrome. And for children with Down syndrome, they can thrive, they can do well in the society. It's just that it affects their cognitive ability. So it affects how they remember things, how they think. Learning is slow. It takes time for them to absorb information. We have a 30-year-old Down syndrome girl in Ibadan. If you ask her for age, you know she's 15. If you ask her tomorrow, she will say she's 10. She doesn't even know her age up to this moment, but she's very friendly. She plays. She's very hardworking. She does toilet training for the rest of the children, but she doesn't know her age. So sometimes it affects their intellectual ability. Some of them can go to the mainstream school, they can go to regular schools, and in the aspect of their health, sometimes they are born with. Some of them usually have hole in the heart. They always have heart problems. Some have hearing problems. So it's always good to do all of those tests to be sure. However, Down syndrome is also a lifelong disability, but they can thrive if early intervention is done. So the last topic I'll be talking about is the management, how to management care. So for all of them, early intervention is key. And one thing we need to um, one thing we need to do is we should always pay attention to their strengths rather than their weaknesses. We should always pay attention to what they can do rather than what they cannot do. When we focus on those things, they thrive. Another important factor is love. Love. If you show children with disabilities love, they are, in fact, you will see them doing things that's why in some situations, some doctors will say, "Oh, your child will not be able to do this. Your child will not be able to do that." That's not true. Sometimes when you show that child love, and the child is exposed to right interventions, you see them doing way more than what they were told that they cannot do. So love, they cannot have enough of love. We need to keep showing them love and all of that. Then acceptance. The other speakers spoke about acceptance. We should not pity them. Accept them. Like I said, we all have our disabilities. We all have our challenges. If we ask our friends our disabilities, they're all managing us. So we should learn to accept them with their needs. With their The moment you accept them, you'll be able to provide the right care for them. But the problem we always have is lack of acceptance. Oh, my child does not have autism. My child does not have cerebral palsy. My child does not do this. And in the process of denial, the child is growing older and the child is missing out on the important lessons or therapy the child is supposed to be exposed to. So acceptance is key. Then individualized care. Individualized care. Before acceptance, I think we should also focus on the right diagnosis because a lot of parents had the wrong diagnosis. Some actually went to hospitals and they were told a child that has autism, they were told that the child has CP. I've seen a lot of that. They give them wrong diagnosis. So when you have wrong diagnosis, you have malaria and you are told that you have typhoid. No matter how much you treat the typhoid, the malaria will not go. So a lot of times they are given wrong diagnosis, or they just tell them that, oh, your child has speech delay. Yes, when a child has speech delay, it doesn't come with behavioral issues. The child has speech delay, but the child is doing all that, the child is thriving, the child is obeying instructions and all of that. But a child is not complying, is not obeying instructions, the child is hyperactive, showing all forms of signs of autism, but they tell them that your child has speech delay. Speech delay is different. It just means that the child has issues with speech. But when a child has autism, they give them so many wrong diagnoses. So it's difficult to provide the right help for the child. So after the diagnosis has been done, then we can provide the right individualized care. For children with special needs, we need to, the interventions has to be individualized. This child's need is different from this other child's need. That is why we use IEP, individualized educational plan. That is why some children that are taken to mainstream schools, sometimes it's hard for them to thrive because they are teaching the class the same thing. And for children with special needs, it takes time for them to process the information. The teacher is on number 10. A child with special needs is still trying to understand what number 1 is. So that is why there's supposed to be like a shadow or a therapist to the child that will always guide the child, and then continuous repetition of what the child is being taught. And then a supportive environment for children that have visual impairment and all of that. We have to be careful of the things around. For those that have sensory issues, some of them react to noise. You see some children with autism covering their ears. Yes, because they react to noise. And you are wondering that, is it just this noise that is making him cover his ears? To you, it is just that noise. But to them, they are hearing so many sounds at the same time. So it becomes a sensory overload for them. Then you see them covering their ears. So you need to modify the environment. For those that use the wheelchair, there should be ramps. Just make sure the environment is suitable for them. Then advocacy, as parents, as individuals, as teachers, those handling children with special needs, we need to always advocate for children with special needs, because people don't understand what these disabilities I mentioned now. A lot of people still believe it's a spiritual issue. Parents go to church and nobody wants to sit with them. They go to mosque, nobody wants to associate with them. Even when they go to hospitals, people are standing up, they don't want to sit beside them because they believe it's contagious. And really, for some people, you can't blame them because they don't have the awareness. So nobody wants to be sick. It is just unconscious that you see someone that has a particular sickness and just want to avoid the person. Sometimes it's not even intentional. But if we keep creating awareness, keep advocating for them, we keep talking on their behalf that, okay, this is not contagious, they can learn, they can do this. That is why most of my children, I take them out. Recently, for children, they went to a private cinema. We went to a private cinema, and then the driver that took us, because we have to get a bus to add to the vehicles, he said, would they really understand the movie? I said, I'm not taking them to go and understand the movie. Even if they don't understand the movies. Last year, December, we did spa dates for them. They did spa with massage and all of that. And then parents are like, what's wrong with this woman? What's the meaning of this one again? But at the end of the day, the children really had fun and it was really interesting. So advocate, then diets. For children with autism, we need to be intentional about their diets. They are not supposed to take food with sugar, food that has preservatives, that have chemicals. It's just like a diabetic patient. It prevents a lot of things. So that is how they should eat. In fact, in other countries, they have their own seasoning cubes, they have their own pots, they have their own oil, but they are quite expensive. However, we can manage whatever we have here in Nigeria. All our food is carbohydrates, but we can modify most of this, food to suit them. Any food that has chemicals, we should take it out. Any food that has preservatives, we should take it out. Most of those things that that it's not even good for us to eat, they shouldn't eat it. Those fizzy drinks, they don't need drinks. All this happy hour, okay, I'm not supposed to mention names, but all those drinks that has preservatives, they should not take it. They can always take the natural drink. It's always good for them. And the necessary test needs to be done. So some children, they usually have heavy metals in their system. So that's why sometimes they are very hyperactive. So there's always a need to go for heavy metal testing to be sure. Because sometimes you realize that probably we are supposed to have 5% of lead in our body, and this child has 60%. What do you expect? So what the child is doing at that moment is not the child's fault. The child is reacting. The child, and every behavior is communication. We need to understand them. That is how to manage them. But you need to really understand them. You need to pay attention to them. That is why anybody who doesn't have passion cannot work with children with special needs. You don't work with children with special needs because you need money or because of whatever. You must have that passion. You must have the love. So you are able to understand them. You're able to see that, oh, this child wants to do, this child wants to be, this child wants water. Every behavior, sometimes they are screaming, they are shouting. The child might not be comfortable. There was a child that kept on crying for no reason. The mother said, I'm beating you. I said, no, something must be wrong. By the time they took him to the hospital, they realized he had ear infection and they didn't know. So because the child could not express himself, he was just throwing tantrums and doing. So every behavior is communication for children with special needs. Then support groups. It's always good to join support groups for individuals for parents especially. They can join groups where there are other mothers that have children with special needs. It's easy for us, even me, to tell you that do this, don't do this, do this, don't do this. I don't have a child with disability, but I have other children I cater for. I know how I feel when my child is not feeling fine. So Other parents that have children with autism, children with cerebral palsy, they will be in the best position to advise you, to tell you what to do. Sometimes their children exhibit some sort of behavior, and then when you just go, and then you've been very worried that, oh, what is going on? But by the time this mother that has gone through the same situation talks to you, you feel a lot better. So it's always good to join support groups, and then monitoring and evaluation. When the child is on therapy, we need to monitor what the child is doing. As much as there are so many therapists out there are so many therapists with certifications in the world, all the certifications in the world. But are they actually giving the right care to the children? We are not trying to um, spoil anybody or but then parents need to monitor what each therapist is doing with their child. Because sometimes we have this education, we can speak so much grammar, but are we really providing the right care for the child? Is the child improving? In our center, we have the IEP is marked every day. You can see the progress of your child. Every month, we give you a form to fill. Let us know if you've seen any improvement. Let us know if you've seen any regression or anything. Let us know. So it has to be monitored. You can't just keep a child in the school. For some parents that they believe the school will do everything. No. In fact, children learn better. Parents are blessed with these superpowers. So children learn better with if the parents teach them. There are some things that the teachers will struggle to teach them. But by the time the mother is involved or the father is involved, these children learn better. So it takes a village to cater for children with special needs. Everybody around. In my center, you can't be working with me and say you're avoiding the children. No matter the position, the post you are holding, even if you're a security, you will carry the children. If you are the driver, you will pay attention to them. If you are the cook, we're looking for a cook, and some will come and say, "Will I be feeding the children?" If it's just cooking, you will feed the children, you will stay with them. If you know you cannot stay with them, then you cannot work here. So it takes a village. Everybody. In the case of Kanye, the grandfather really, there was a lot of efforts from the parents, the grandparents, everybody worked together. The mother, according to her, she said she had to resign her job. She's a medical doctor. She had to leave her job to pay attention to Kanye. The father, there's so much support for him. That's why they are able to identify his strengths, because the grandfather said he was always drawing on the wall. He was always painting, and in a regular home, they will be shouting at the child and screaming that why are you just writing everywhere? Instead of them to try to study the child and observe that why is this child always writing? Is this his strength? So the grandfather said he will buy a pack of A4 paper for printing, and then Kanye will draw on it in 30 minutes. So they have to take him to they employed an artist or something, and that here he is today. He's known all over the world because he got the right support. So it takes a village to cater for children with special needs. And lastly, self-care. Those that are taking care of children with special needs, you need to take care of yourselves. People look at me and say, you don't even look like, some will say you don't look like what you are going. I can't pour from an empty cup. If I don't take care of myself, I will not be able to take care of the children under my care. So I take care of myself as well. A lot of parents experience burnout, they experience so much, they are barely take. There was a time a parent was so overwhelmed. She has children with special needs. I told her, when is your birthday? She told me, I said, I called the makeup artist. Go and do makeup for her. Let her take pictures for her birthday. You need to take care of yourself. The children need to see that you are happy. Once they see that you are happy, they are happy, and learning takes place. So thank you very much.
Thank you so very much, esteemed Mrs. Achille. But not for the fact that our time is fast spent. I would have loved for you to just continue and continue, because this is like 6 months education packed into 1 hour that you just delivered. So thank you so very much. And this is the kind of education that parents should have, and even grandparents. Everyone who has children or grandchildren or great-grandchildren, children around them generally, which means it's actually a kind of information that everyone should get. Thankfully, we are recording this and we are going to post it, publish it everywhere for people to watch and learn from people who are really in the midst of it all. Nothing like hearing from the horse's mouth. Thank you so very much once again. So I would like to invite esteemed Ms. Aderonke to kindly share 1 or 2 things with us before we call it a day. Please go ahead before you see us.
Hello, everyone. Good afternoon or good evening, wherever you are joining us from. I wish to, first of all, apologize for joining the meeting very late, and of course, not being able to present as I've discussed with the organizer of the program. This is because of my very tight schedules. I multitask. I run a lot of streams of businesses, and then I have a load of applications on my table that I need to be submitted tonight and other days. So that's the reason why I have not been, or I was not able to participate from the beginning. All right, thank you very much. I want to say thank you to Mrs. Nifemi. She really did a very good job. I enjoyed the topics on Down syndrome and autism. I have a niece that has a special need child, and we've been battling with autism too. So I was able to catch some ideas on how to manage autism in a child. Thank you very much for the presentation. It's quite educative. I don't know what I'll be talking about because our time is already fast spent, but I promise that in the next meeting, when we're going to be having this type of meeting again, I would like to participate from the beginning and also contribute my knowledge towards advocating for the rights of persons with disabilities in Nigeria. I'm, of course, is a woman with a disability. I'm an amputee, and for almost 18 years. And being an amputee in Nigeria is not something very easy because you have to double your effort to achieve all that you need to achieve. And getting a prosthetics also in Nigeria is quite challenging because that's the area I specialize on. I'm the founder of the Aderonke Rehabilitation Network. It's an organization that helps to provide prosthetic limbs to poor amputees or indigent amputees in Nigeria, especially those that cannot afford quality prosthetic limb like what I am using to support myself. My prosthesis was acquired from Germany, Ottobock, Germany, some years back, and it was quite expensive. And most amputees in Nigeria are facing this challenge of acquiring quality prosthetic limbs. So that is where my foundation come in to support people who need this device. So we'll continue to advocate for the rights of persons with disability according to the United Nations Convention on Disability Rights, and of course our own disability laws we have in Nigeria that talks about the prohibitive acts against persons with disability. So thank you everyone for joining us and for your time. We appreciate our key speaker, Mrs. Nifemi, and the organizers of this event or this program. We appreciate all of you. Thank you for your efforts. Thank you very much. I sincerely appreciate it. God bless you all.
Thank you so much, esteemed Ms. Aderonke. You are a bundle of encouragement. I just have to say it, okay? You are an epitome of what we are discussing today, how that someone who is living differently can still succeed in Nigeria, can still excel, not just in Nigeria, anywhere the person is. And that's the essence of this webinar. And we feel really bad that we didn't have the full dose of what you had for us today. However, like you rightly mentioned, this webinar is going to hold again, who knows when, but you'll definitely be informed. And we do hope that, like you rightly said, you'll be available to give us your bits. Once again, I'd like to thank Dr. Miracle for performing a miracle today, standing in for Ms. Aderonke. You were wonderful. You were exceptional. And I'd like to also thank esteemed Mrs. Nifemi Ajileye. With your busy schedule and all the children you had to take care of, you still came out to give us this education. It's invaluable, I just have to tell you. And thank you, esteemed Mr. Aderonke, once more for beating all the odds, both in your real life and today, to still show your face in this meeting, in this webinar. Some people would have said, I already missed the time. Let's leave it till next time. But you honored us and you showed up. That counts, and we want to thank you. Special thanks to all the members of TAAE Foundation. And before we go, like we said, we're going to post this recording on our socials. Please do us a favor, whether you're a member of the foundation or not, do share it whenever it comes. You never can tell who will pick it up from anywhere, and it will save a life. It will save a family from heartaches, and they will learn one or two things that will help those people whom we are trying to help in the University of Abuja, and that is this June. So you watch out on our pages, social handles, you will see the announcements, and please do follow along. Once again, thank you for being part of this today. God bless you.